Hello everyone, my name is Gill, and for my plan change project, my topic was using VR and AR to facilitate innovative learning for better patient outcomes. So as you may know, there's virtual reality and augmented reality. So when we have talking about virtual reality, we're using this technology as a headset to create an immersive 3D simulated environment, such as seen in a lot of video games today in the metaverse, for example, versus augmented reality, where you use the existing real world environment and you put virtual information on top of it. You may have seen this in a lot of like Amazon. Like if you want to buy something and try something before you buy it, you can actually see how something looks in your room before buying it. That's pretty much augmented reality. And then for my topic, I decided to use Rogers 5 stage theory. So stage one occurs when you're trying to understand why you want this change. So you want to impart knowledge in terms of the reason for the change, how it will occur, and who will be involved. Stage two is whether the people will like it or dislike it. So you're trying to persuade others to accept change by relaying essential information. Stage three occurs when they either adopt or reject. So you decide whether to ultimately adopt the change by analyzing the data and implementing a pilot study. For stage four, you use and reinvent. So you implement the change on a more permanent or established basis. Stage five occurs when you're reinforcing and reversing. So afterwards, you want to confirm adoption of the change by the individuals affected by the change. So how this applies to my topic, for stage one, that's all about understanding. So you want to see why you guys want this change. And it's to enhance the learning experience. You want to simplify the learning of complex information such as EKGs and other hard subjects. You want to integrate the virtual objects into physical space. You want to enhance the sense of reality. You want to make students feel more confident and prepared for the real world, ultimately leading to patient outcomes, improved patient outcomes. Stage two was all about liking and disliking. So once again, when learning through AR increases outcomes in numerous phases of training, such as professional knowledge, social skills, cognitive and practical skills, innovation, proficiency, and creativity. Stage three is all about adopting and rejecting. And then recent studies showed that 80% of participants reported that VR was more effective than reading and equally or more effective than didactic teaching. So you want to identify the problem. What's the problem here? So students just are not retaining knowledge through the traditional teaching methods, such as reading, flashcards, lectures, and practice questions. Here we have an opportunity to enhance the learning experience and improve practical skills through the use of VR and AR. After this, people will be better equipped for real-world situations and ultimately leading to improved patient care. So for my PCAT, my question was, do students who use virtual and augmented reality to facilitate innovative learning have enhanced retention, confidence, and practical skills to apply to the real world when compared to students learning through the traditional teaching methods such as flashcards and lectures? For my review of literature, I primarily used PubMed, Sinhal, and Google Scholar. The key terms that were identified were virtual, augmented, reality, education, nursing, students, innovative, patient, skills, knowledge, and teaching. So the need for change. Why do we need this change? So again, many studies have showed there's significant improvement in muscle memory and understanding following VR training, and 100% of participants agreed that VR allowed access to educational opportunities that were simply not possible before. And statistically significant enhancement in self-reported confidence after VR training in parameters such as identifying brain structures or something just simple as basic wound care. So for the summary of evidence, studies have consistently shown that using virtual reality and augmented reality significantly enhances the learning experiences and increases student engagement. However, in another study, one researcher found that while VR is a feasible training approach to increase knowledge attainment, it should currently be used as a complementary method to conventional teaching, not as the sole teaching strategy. So we don't want to completely replace traditional teaching methods. We want to use this as a complement. Different research designs were utilized in these studies. Another researcher employed a quasi-experimental design to compare students learning newborn assessment through VR versus conventional lab-based environments. Most of the dependent variables in these studies included students' self-understanding, self-confidence, proficiency, and clinical judgment. In a separate study by Chang and Lai, qualitative research was applied to 60 nursing students, divided into 6 focus groups. They experienced nasogastric tube care proficiency through VR, and subsequent interviews were conducted to assess the effects of these teaching methods on their learning. Researchers used various methods to measure the variables based on the type of study conducted. So the recommended best practice. According to one study, the best practice for using VR and AR in education relies on the available evidence. Students should use VR and AR to enhance their knowledge and comprehension, not to entirely replace their current learning methods. The use of VR and AR should be student-centered, involving a combination of physical and virtual objects to optimize the educational experience. Immersive virtual surroundings should be designed to make students feel like they're part of the scene rather than just observers outside the scene. To maximize the benefits of VR and AR, focus on concrete learning objectives for each session and reinforce them frequently during the learning process. This technology makes complex nursing theory easier to digest and enables simulation-based learning, adds a strong focus on practical skills, and tests students' ability to work under pressure. For example, you would have improved efficiency. AR and VR simplifies complex topics by adding visuals to the text-rich content. AR creates an immersive experimental environment that boosts students' engagement and interest when used for practical training. As a result, students understand information better and concentrate better during classes. We would also have increased accessibility. This technology removes geographical barriers and allows students to access training remotely at any time they need to practice. Unlike virtual reality, used to create an entirely digital environment, AR doesn't require students to have special equipment. They can access AR simply through their smartphones. You will also get more realistic experiences without the risk. This technology used to recreate dangerous situations and give realistic impressions without putting actual patients at risk. Students use this technology to practice on virtual patients configured to simulate hundreds of health conditions. You'd also get enhanced personalization. So when paired with machine learning algorithms and analytical tools, this technology can monitor student performance and generate comprehensive reports with a personalized analysis of students' weak and strong skills. And additionally, it's optimized cost effectiveness. So contrary to what most people think, investing in this technology actually reduces cost. With AR, there's reduced need for anatomy, theaters, cadavers, and mannequins for practice. For example, if you have an average of about 3,000 students, adopting VR is 52% less expensive than maintaining a classroom. Your AR costs will be even lower, considering that all you need to run AR applications are laptops or smartphones. AR enhances nursing education in many ways that benefits both trainees and teachers. So for policy and protocol for change, we want to evaluate existing styles of simulation within the classroom, considering various learning styles of individuals and students' self-awareness of clinical understanding and confidence. We want to establish virtual simulation techniques, such as using specific software with complex scenarios for courses like the ER, operating room, or OB. We want to integrate the selected virtual simulation technique into clinical education alongside conventional learning methods. Advanced techniques are crucial to expose students to a variety of surroundings and enhance their confidence in clinical understanding during the transition to a real-world hospital setting. VR and AR serve as a feasible complements to conventional simulation techniques, facilitating knowledge acquisition and ultimately boosting students' confidence. These emerging technologies provide a safe environment for individuals to practice challenging skills without the fear of endangering real patients. So factors affecting change. So factors that are enhancing achievements are communication, leadership. These factors are always crucial in any type of clinical setting. You want active participation and that engagement from the students, and everyone should understand their roles. Factors that reduce achievement or things are such as financing equipment, inadequate training, and then there's always people that are going to be resistant to change. So my plan of action, we were assigned 3 different approaches, and I ranked them from least feasible to most likely to succeed. So first one would be to the use of VR and AR as special stores, kind of like an on-demand thing. of like a gym membership. Like you try it, you like it, you keep going. If not, you can opt out anytime. So the pros for this would be the ability for anyone interested to try out. And like I said, you can opt out anytime. Consequences for this approach would be definitely more costly. They're usually more for-profit businesses. Probably open select hours and days, not enough locations, and maybe far for some students. Approach number 2 would be the use of VR, AR at individual homes. So the pros of this would be self-paced learning and guidance. It'd be flexible, and you'd be learning in the comfort of your own home. Cons for this may not be able to get immediate clarification, not able to ask for questions from the instructor, and possibly might be confused and more costly because each student pays for the individual subscription and teaching lessons. And approach number 1, and most likely to succeed, would be the use of VR, AR at teaching institutions such as CDU. So pros for this would be large group teaching. You're going to enhance student participation, and you'd have the ability to ask for clarification. More cost effective, you could have 1 to 2 3 instructors for multiple students. Cons for this would be, like any settings, school settings, maybe noise and other students, etc. So these would be the expected changes we would see after the change has been applied. You would have improved memory retention and comprehension of concepts. You would simplify the learning of complex information. You would have increased engagement and motivation among students, and enhancement of theoretical knowledge and practical skills, assist students struggling to understand difficult concepts, reduce training costs, and accessibility for students with disabilities, and overall immersive learning experience. So how do we implement this? 6 steps. So first, you want to acquire the necessary equipment with the aligning software and teaching lessons. Average cost I looked up was anywhere from $30 to $1,000 for a headset. So I mean, it can all vary depending on school budget and the necessary level of complexity. Number 2, develop a plan for VR and AR learning. So you want to use surveys and quizzes to assess the baseline knowledge, see where students currently are before applying the change. You want to maximize the use of this technology with lesson plans that guide students to their learning objectives that lead to success. And then you want to ensure you have the actual space, physical space, to ensure the safe usage of this equipment. When you have the headset on, students often ignore the physical surroundings. So you want to make sure safety is there. Number 4, you want to do orientation and training of this new equipment. Ensure everyone comprehends the proper use. Have students perform a return demonstration and safe handling. Clarify any questions before starting. And then you actually want to do it, moderate and supervise the use. Ensure students are learning adequately as planned. Ensure students have increased retention and comprehension of concepts. And lastly, you want to apply the acquired skills to the real world. For instance, you can demonstrate skills to the professors in simulations, and then modify and adjust lesson plans accordingly. And then you want to see evaluation. Did the change work? Like over and over again, numerous studies indicate highly effective. Students who are successfully complete learning activities enhanced by AR are more likely to achieve both enhanced theoretical knowledge and practical skills. And how would we do this? Like I said, you want to use various tools to observe from the baseline. Use surveys, quizzes, interviews, observations, and then change facilitators, identify the need, sources of funding, communication, leadership, and teamwork, and then change inhibitors, resistance, and then there's people that are always fear of failure. They don't want change. Alternative approaches, do sim labs or mock codes. But for this, we've seen there's lack of supplies. You can't really bring concepts to life like with AR and VR, and moving forward without competence. Artificial intelligence, there's a lack of hands-on experience and definitely higher production cost. Different things for next time, maybe increased surveys and assessments before the change, and increased funding for more options. And here's a little video I found, kind of puts everything into action.
I was really excited to be a part of the first cohort to experience the virtual reality for the Moraine Valley Nursing Program.
How are you feeling?
My pain usually happens when I cough, and I rated a 2 out of a 10.
I have never done virtual reality before, so I did not know what to expect. And after doing the training session and the simulation, I actually grew very fond of it, and it definitely helped me become a better nurse.
His blood pressure is dropping. It's now 108/70. I think he's having an allergic reaction. We had a patient that was receiving an antibiotic and he went into anaphylactic shock. So we were able to care for the patient, we were able to call a physician, take vital signs, and we were able to treat him until he was feeling better.
And this quote I thought that was really relevant. So it says, "Teach me, I will learn. Show me, I will remember. Involve me, I will know." And these are my references. Thank you.